Oh, okay.
Oh yeah, so now you're alive.
Hello, and thank you for joining our webinar today entitled Family is Essential, a conversation with family advocates about COVID-19 and youth justice. My name is Michael Lampierre, and I am the director of the Center for Juvenile Justice Reform at the Georgetown University McCourt School of Public Policy. This webinar is being co-hosted by CJJR and the Vera Institute of Justice. And we're so delighted that you're with us for this very important discussion. Before I move forward with offering some opening remarks and covering some webinar housekeeping, I do want to turn to my co-moderator and partner and friend, Krista Larson from Vera, to say hello and to introduce herself. Krista?
Good afternoon. Thank you so much for joining. I'm Krista Larson. I'm the director of the Center on Youth Justice at the Vera Institute of Justice.
Great, thanks Krista. And again, we want to thank everybody for being with us for this extremely timely conversation. Across the board, we know that research and everyday experience teach us that family engagement and empowerment and partnership is absolutely essential when it comes to juvenile justice policy and practice. When we look at that research and we look at our experiences, we know that our outcomes are simply better when we support families, when we engage them, when we empower them, and when we partner with them in meaningful ways. Whether that's in case planning, whether that's in programming, whether that's in communicating with families, or whether that's in providing direct supports to families. In normal circumstances, this work and embracing that type of approach is extraordinarily challenging. But in these times, in the face of this crisis, in the face of this pandemic, that work becomes even more challenging. And so we at Georgetown, CJJR, and at Vera felt that it was critically important to focus on the need for family engagement and partnership and empowerment during this time, to have a conversation with leaders in the field and family advocates about exactly what are those challenges that families are facing right now, and some of the strategies and ideas for ways that the systems that serve families and young people can do it in a way that is thoughtful and best informed to position ourselves for success, promoting the well-being and safety of all. So we're delighted to have this conversation. Before I turn to our esteemed panelists for introductions, I do want to cover some webinar housekeeping. First and foremost, we do intend for this to be an interactive webinar. And while we won't be opening up the phone lines, we do ask you all as the audience to submit your questions using the questions and answers box that you see on your screen. Please note that we will not be using the chat function for this purpose. We ask that you use the Q&A box instead. We'll do our best to answer as many questions as possible. There will be dedicated Q&A time at the end of the webinar. Please also know that the webinar is being recorded, and that we will share that recording for all to see afterwards, including links to all of the webinar registrants, as well as posting the recording on our respective websites at CJJR and at Vera. So with that housekeeping out of the way, I now would like to turn to our incredible panelists to introduce themselves and say hello. As I mentioned, we are joined by three wonderful and remarkable leaders and advocates who have dedicated their careers to supporting families of young people who touch the justice system and other systems. And to get this conversation started, we wanted to turn to Tracey Wells-Huggins, Gina Womack, and Sue Badeau to say a little bit about themselves and to introduce themselves to everyone who has joined us today. So Tracey, we'll start with you. If you could say hello and share a little bit about yourself.
Good afternoon, everybody. My name is Tracey Wells-Huggins. I'm a registered nurse who lives in Vineland, New Jersey. I have dedicated myself to public health, carceral health of young people and adults at this time, because I see a significant need for that. And I'm also the founder of Renewed Minds and a partner with Justice for Families.
Hi, good afternoon, everyone. My name is Gina Womack. I am a co-founder and the executive director of Families and Friends of Louisiana's Incarcerated Children. I'm also the proud mother of three. FLIC has been around for the last 19 years. And I say welcome from the great state of Louisiana, where we are serving at the bottom of most child-serving necessities like education, poverty, and mortality rates. However, we are at the top here with the most children who are incarcerated that have tested positive for the coronavirus.
Hi, everyone. I'm checking in here from Philadelphia, and my name is Sue Badeau. I do work with Justice for Families, which is an organization that really is about ensuring that families who have loved ones, particularly in the youth justice system, but also throughout the full spectrum of the justice system, that families have a voice, that families have opportunities to develop their advocacy skills and partner with the systems and the communities that involve our young people, our children, and our family members. I am a parent of many children that came and joined our family through both foster care and adoption, as well as by birth. And over the years, we've had a few of our children, a couple of our sons that have at times been incarcerated both in the youth system and now currently in the adult system. We still currently have two of our family members incarcerated. So this is a topic that I'm absolutely passionate about. And I also work with the child welfare system. So sometimes, you know, we see where those systems intersect or collide. So I'm just excited to be here with you all and passionate about the topics we're going to cover.
Great. Well, Tracey, Gina, and Sue, thank you so much for being with us today. I think it goes without saying that I speak on behalf of CJJR and Vera, that for you all to take your time out of your day, particularly in light of what everybody is experiencing right now, is most appreciated. And we're so grateful that you're with us today to share your insight with everybody who's with us on this webinar. So again, thank you so much, and we look forward to the discussion. And with that, I'll turn it over to my co-moderator, Krista, to get us going.
Thanks, Michael. So we wanted to make sure that today really centered the experiences of families. And we want to lead in by acknowledging the losses and disruptions that we are all feeling right about now, which range from daily inconveniences and frustrations all the way to very real losses, grief, and economic hardship. And so just to get us started by thinking about the families that we're talking about today, would you each in a few words just share a little bit about what you're hearing? How are families feeling right now? And can we start with Gina?
Sorry. Yeah, you know, families are at this moment exhausted. They're afraid, you know, and I've seen this before, but I feel like this is a new level, right? Because I mean, our families have always had multiple issues to deal with. However, we're talking about losing jobs, at risk of losing homes, they're losing loved ones. And to think about a child that is locked in cages and you can't, far away from home and you can't get to them, is really exasperating. But, you know, again, our families are survivors, they're resilient, although I really hate using that word because we have to use it over and over. But thank God that they are, because they know that they have to lead this fight, because without their voices and, you know, putting themselves and their young ones on the front line, we'll never see any change. So exhausted, but still somehow fighting.
Maybe we'll turn to Tracey now.
I echo everything that Gina just said, and I would also add a sense of disconnectedness. I know as a mother whose biological son is currently not in the system, but having other sons and daughters who are currently behind the walls, there's also an intense feeling of helplessness and powerlessness in terms of what you can actually do to become more connected with them inside. Families are also stating that they feel frustrated at the lack of importance that their voices are being allotted at this time. There doesn't seem to be an intentional quest for any type of partnership at all. So it's incredibly important for us to make sure that we're standing in the gap and being the voices that we need to, parlaying those informations, thoughts, feelings, emotions to the people who currently control power.
Thank you. And Sue?
Yeah, so again, I would absolutely echo everything that both Gina and Tracey said, and add that those are like generalized ways that families are feeling. And we also have to recognize that every family is unique and different, that this is a collective trauma, and there's fight, flight, freeze, there's different ways that people respond. And so families are going through all of that in their own unique ways. And this is piled on top of the trauma that they've already previously experienced. So, you know, some are shutting down while others are getting more of the fight. And both of those reactions are completely normal. And as Tracey said, it's, and Gina said, it's exaggerated in times like this. So it's because not only are you facing a crisis or a feeling of crisis with your loved one that's locked up, but now your whole family is in crisis, like everyone in crisis at once. It's a lot more to juggle. And this is what I hear also from families, is that I'm terrified and scared if my child doesn't come home, if my child is there and I'm hearing these scary reports, but I'm also terrified and scared if my child comes home, and how will I be able to keep him safe at home in this crisis? So it's like I'm caught in this space where I'm scared either way, and I don't even really know for sure what to be fighting for, what to be advocating for. Many families are just feeling that sense of being overwhelmed and not knowing kind of where to put their energy because the crisis is so pervasive.
Thank you for that. And I think we want to build on that idea. And I'm going to turn to you, Tracey, as you mentioned, you are a nurse and a public health educator and professional, as well as a parent. And we know that although, as we've touched on, all of us are being affected by this virus and this crisis, but we also know that communities are not affected equally. And I'm wondering if you could lead us into the discussion, talking a little bit about the impact of COVID-19, excuse me, and how that maps onto some of the disparities that we see, racial disparities, health disparities, economic disparities across our country.
Yes, so race impact on health is not a new phenomenon. There have always been disparities that existed between the haves and the have-nots. Sadly, it often takes a massive upheaval in our society in all of our systems for there to be any substantive change or attempts at that. And there's been no other primary example for that most prevalent in our society than what we're facing right now in light of COVID-19. If anything has been amplified at this time when it comes to our systems and our folks who are behind the walls, it's that tremendous vulnerabilities continue to exist. And these vulnerabilities are not something that are new, right? These are things that families have always been talking about. But right now, at this particular point in time, it's exponentially exposed the areas and opportunities that exist for us to address them. So it's a well-known fact that the lower your socioeconomic status, the higher your risk for health compromise. No news there. One of the most lethal factors of COVID-19 from a nursing and health perspective is the effect it has on people with pre-existing conditions. Our jails, prisons, detention centers, and camps are filled with folks who have these very underlying pre-existing conditions, and that makes it a hotbed for potential death and destruction behind the walls. I'm glad for the framing of this question, though, because it kind of takes fully into account, finally, the triad of cross-system involvement and participation and partnership that needs to happen, along with that of family and communities, because without that, we're not going to be able to address the issues as they stand. It's imperative for us to keep this in mind as we come up with ideas and recommendations to address the issue as it stands. This is a multi-dimensional crisis of both community, the caring communities, resources, presence and lack thereof, public health, and economics. And in order for us to address this, both while we are currently in crisis and then thinking about what's going to happen after the fact, we need to make sure that we're mindful of all of those dynamics. So what do we currently know about the virus? We know that it affects those who are compromised already. We know that we've been told that the basic things that we can do to protect ourselves involve things in community that we're already employing. Simply by looking at us here, social distancing has been the #1 thing that they've been talking about. Basic infection control practices, washing of the hands, cleaning and disinfecting our areas where we live, our spaces, and also making sure that we are not only seeking medical care when we need it, but we are taking care of ourselves symptomatically in the event of any symptoms that may manifest as we go along. And while we're doing this in the community, the question becomes, how well are these things being carried out behind the walls? What does it look like for someone who is incarcerated to have to try and social distance? I know there are many states that are applauding themselves when it comes to youth justice about the decreased numbers of young people who are in systems across the nation. However, that's not always the case, and we need to be open and honest about that. How are we supporting effective social distancing? And that doesn't mean placing people in solitary confinement, because there's no indication that that would keep them safer. We have to understand that we need to be looking at what are the current practices for infection control? Who's done the education for the hand washing and the increased amounts that we need with that? Also, who's monitoring the fidelity of the practices that are in place? Who's making sure that on both sides of the spectrum, that staff are being kept safe with the proper amounts of personal protective equipment, and also our young people, our adults and elders as well who are behind the walls? What are we providing for them? The CDC has noted that the highest risk populations are not only those who are socio and economically challenged, but those who are institutionalized in setting. They've lifted up nursing homes and long-term care facilities. I would like to add that we need to be considering the jails, the prisons, the detention centers as well, and the immigration camps, because these are all places where folks are really pretty much clustered together with limited resources, limited access to healthcare. Staffing ratios are very, very challenging in these places right now. And so we need to be considerate of what's happening on both sides of the spectrum. So staff and facilities have been facing major issues as well. And while they are really working hard to address the systemic changes that are happening, great things have happened in terms of increasing the amount of teleconferencing that takes place, increasing the amount of calls that are being made available to those who are locked up. However, decreases in person-to-person visitation has placed a tremendous amount of mental stress on many parties, not just the families on the outside, but also our youth and loved ones who are behind the walls. We need to be considering not just those things, but the mental health aspect of everybody who's involved. There's not enough support in place. We don't have enough data to find out what testing mechanisms are in place inside, and there is tremendous fear. So from a nursing perspective, there are a lot of concerns, because if there's limited testing based on symptomology, then there could be the possibility of increased sped by the time the symptoms are noted. Many people who are working within the system are being temperature checked as a basic protocol when they go in. And we know from a medical perspective that by the time someone is actually symptomatic with COVID-19, that there has been a window of exposure whereby they were totally asymptomatic. What does that look like for our young people? What does that look like for the co-workers who are working with people who don't have a fever today, but may manifest one tomorrow, who've been throughout the whole entire facility and in partnership or connection with their co-workers? There are so many health concerns right now, and yet there are recommendations that are in place and are to come.
Thank you so much, Tracey, for that really thoughtful response. And I want to build on what you just shared by turning to Gina to talk a little bit about the calls for action that we're seeing nationally with respect to young people in the type of custodial settings that you were describing, Tracey. Detention facilities, correctional facilities. Gina, you've been front and center in the advocacy efforts in your home state of Louisiana around these issues. Can you share a little bit about what you're hearing, what families are experiencing during this time, specifically around these calls to get young people back into the community who are currently placed in these types of facilities?
Yeah, excuse me, there's just a lot to be said about that question. And so I'm gonna try to keep it as organized as possible. And especially, you know, as we talked about really earlier about how our families are feeling, you know, the frustration, just a sense of hopelessness, but then it also leads to thinking bigger picture, right? And a lot of the frustration is with the current situation, but also with the current situation and how it's been for many years, right? And so what we're seeing during this crisis really has exacerbated the things that we've been talking about for many, many years since we started our organization, right? And the fact that a lot of those practices have not been put into place. Like, we continue to find ourselves in a vicious cycle. So yes, families have been frustrated, tired, exhausted, and sad, but we also have been working and thinking about and continuing our struggle and our path and trying to keep the media and the systems focused on long-term solutions, right? So we know that we need to continue to identify ways to innovate and create pathways out of the system that do not necessarily require new legislation. We need to be creative and take advantage of openings that allow for us to be innovative and make changes where stakeholders least expected. And so a lot of times we've been talking about, we need to stop asking for permission, right? So thinking about long-term solutions, we know that a long-term solution is effective community-based alternatives to detention and a functional process that cuts through bureaucracy and move children efficiently towards culturally competent, culturally responsive healing and support networks within their homes and near their community, right? So we've been fighting and calling for downside divesting in prisons for a very, very long time. And if you think about it, you know, hindsight is 20/20, except the frustration that families continue to feel is that we keep saying the same thing over and over. And had we moved to smaller community-based facilities, we wouldn't have those large institutions that cannot provide the protection and supports that are necessary. We can't provide for the rehabilitation. And so when this pandemic hit, much like Katrina, we should have been a little better prepared, but we were not, because why? You know, it's the constant knowledge that our kids and our families, our communities are dispendable. There are afterthoughts, if not even really an afterthought, right? And so we definitely try to continue to look at long-term things that we need to work on and short-term. And so for the short term, we've been fighting because we need to focus on accountability measures for the government to reinvest dollars in alternative models and mandating public systems, you know, to sit at multidisciplinary tables where parents and youth not have a voice, have the voice, right? And so it's like, and you know, and Sue, Grace, you know, if you all knew me before, and now it's like, you know, we can't be passive. And it's like Flick has always had a saying that's like, we're not at a table, we are the table. And having to have that voice of being like, when we're, you know, like when we're talking, everyone needs to listen and follow. And had those things happen, we would probably find ourselves in not as much in this situation, but we have to do what we have to do in the current situation, right? Because when a crisis or a scandal hits the news, everyone is eager to hear about the solutions, and their attention, you know, soon wanes, and any positive steps forwards can be erased. But we're trying very hard to continue to stay and continue to have that beating drum. So we've been working with our national partners, Youth First, to put out a call to free all of our youth. We've been working with local partners like Louisiana Center for Children's Rights, Ubuntu Village, folks like that, to continue to stay the course. We've done you know, we have to go and because we're forced to fight the same fight, even when we were successful in closing down Tallulah 20 years ago. We have to continue on that path. So we've been doing all the things that we are forced to do while still thinking about long-term solutions. So we've been working with Youth First. We put together a letter that has had organizational signatures to send to the governor. We put together a petition that has close to 1,000 signatures. We participated in a national press conference. Families have been telling their stories, putting their young people at risk. We need to really understand that when families are on the front line, like they're really, really on the front line, putting themselves and their children at risk, because we're having to hear from the young people inside, and the parents are sharing their stories publicly, and that leaves the young person, you know, very vulnerable. So I'm gonna wrap it up because there's just a lot of things that we have been doing. Media is really important, but we're also planning next Monday to hold a emergency town hall, so that, because the governor has not been as responsive as we think that he could have been, to make sure that the well-being of our young people are taken care of, and made our families visible and acknowledged them. So we're hoping to confront him personally to be able to answer the questions that we need. So we're calling all parents in Louisiana who are interested to please join us. We're going to do this town hall via Zoom on Monday at 6 p.m. Check out our website soon because it's a work in progress. So a lot of stuff isn't there yet, but it will be as soon as we're done here today. We're going to get it moved. So we've sent out the call, and we're going to continue to fight and have until you know, our voices are heard, because we're struggling for life and death while the world watches. We did that with Katrina. We're having to do it again. New Orleans, Louisiana is the epicenter, and that's not going to change until we change our very racist practices here in the South. And we need to make sure that our children, Black and brown children, are valued as much as other children are. So thank you for that.
Thanks, Gina, for that, and for elevating the importance of investing in community, investing in families, focusing on racial equity and fairness. These are all guiding principles that should be permeating the work of justice systems and partners throughout. So thank you for lifting that up. Sue, I want to turn to you as a follow-up question here. We are seeing in many jurisdictions around the country, with respect to this question of releasing young people from facilities, there have been efforts to expedite that release in some jurisdictions around the United States. Not long ago, I was on another webinar where we featured some jurisdictions where the leaders and the systems were focused on doing that in a thoughtful and safe manner. Sue, what, in understanding that we may have in the audience today watching this webinar, many folks who work in the justice system who are thinking about this process of expediting release. What guidance could you give to systems around this notion of looking at expedited release? And specifically, what types of supports do families need in order to make that transition successful? If you could speak to that, that'd be great.
Absolutely. Well, thank you for this opportunity. And I knew that the time was going to go quickly, and we all have so many passions about this. So I tried to organize my thoughts for this in kind of a simple way to remember. But the starting point I really want to highlight is to answer that part of your question, if system people are listening, start with the idea that children and young people do best in families, and family relationships are where healing occurs, are where safety occurs, are where safety for the whole community occurs, when that can be supported and strengthened. So you have to start from that foundation. But then if we're going to safely and successfully release young people, kind of in an expedited way, so without all the longer term planning that you might have thought was your usual sort of discharge planning process, I would like to just highlight what I'm calling the A, B, C things to remember. And so the A is for ask and anticipate. So ask the families themselves what they need, because it's not one size fits all. So talk to families, anticipate what you think might be some of the needs there or concerns that are on their mind. Suggest, are you worried about this? Are you worried about that? Brainstorm with the parent and the young person. What's going to be the biggest challenge when you go home? What support will you need to make it successful? How is space going to be able to be used in a way that can be safe for everyone in the home? How are you going to manage when people can go out and come in to keep those safety needs that Tracey talked about a minute ago? Really asking meaningful questions, also asking, and how are you as the adult managing bringing this young person home and still the other needs of other family members, siblings, grandparents, whoever else might be in the home, and really asking and anticipating what might be on their mind, and then listening in a meaningful way to what's behind the answers. And so families have fear, families have anxiety, families have this overwhelmed thing that we talked about earlier. So if families are saying, well, I don't know if I can do it, or don't hear that as a pushback that the family doesn't want their child home, but hear that as the family has concerns about safety, they have concerns about trauma triggers, they have concerns about well-being of everyone, and that's the area where we need to channel our support. So ask and anticipate, and of course listen is the A. And then the B is be really concrete about the supports that are offered. Make sure one of those concrete supports is connecting families with other families whose young people have already been released anytime in the past year or years, so that they can have that peer-to-peer support. Be concrete about if this is a family that's going to need support with getting food or keeping their housing or transportation, or that you don't just give them a piece of paper with some referrals on it, but that you guide them, you work with them, you have a Zoom call like this to introduce them to the referral source that you're going to help them with. We once had a family whose child was being released from a facility. She was terrified that her son was going to get back in the same friend circles that got him kind of in trouble in the first place. So she started paying him to stay home. So, a concrete support for that family might have looked differently, of really working with that mom, of helping her. How can you help keep your child safe without having to resort to, you know, paying him every day that he stays home. And so really being thoughtful and concrete, also looking concretely at what might be the trauma triggers that are going to happen for this family, and helping them plan a safety plan. What is your safety plan that you're going to have, that the child's going to have, that the parent's going to have? How do you do your self-care even in this confined, crisis-oriented time? How can we help you have some very concrete strategies that you can use when challenges arise and when trauma triggers happen, because it's going to happen. So that's the B is all about being as concrete as possible. And then the C is really connect, connect, connect. Like I said at the beginning, relationships are the most important thing. Families and community are the most important. So as we're releasing children, have more frequent connections, not less. It's better to have more frequent contacts through phone, through Zoom, however you have to do it, even if they're short. 5 minutes every day is better than 20 minutes once a week, you know, so, or, you know, 1 hour every 2 weeks or every month or something. Try to have those more frequent contacts, help the family and the young people have more frequent contacts, and also help the family identify and the young person identify who is someone else who doesn't live in your home that can support you when you need it. And even when we have to social distance and we can't go out, who can you contact? Who can you reach by phone? Who can be there for you? Again, other families, but also I saw someone on the questions asking about, maybe it's your faith community, maybe it's a neighbor, maybe it's someone in another location, but you can reach through technology. So just making sure that everyone has not just resources, not just information, but actual human connections that can continue to support them as they make this transition. So ask and anticipate, be concrete, and then connect, connect, connect.
Thank you, Sue. And so I'm gonna, you added a lot of things there that are really relevant at the point where a young person might be coming home from a facility and their family is welcoming them back after a period that they're away. We also know that a lot of the young people that are touching the justice system, where the justice system's involved in their lives, have been at home under a period of supervision, and we definitely hope that those young people who their families welcome them will remain at home, and families need ongoing support. And so Gina, I'm wondering if I can ask you to build on some of those suggestions that Sue was just talking about. As you know, we're all going to be moving through this. These ideas are going to have to live over the next coming weeks. And so what ongoing support would be helpful?
Yeah, Sue covered a lot. There's not really a lot more for me to add, because you know, I had my little thing to listen and act, because I mean, I think systems don't do that well enough. They may ask for families to be at the table. They may ask what we need, but are they really listening, right? Because then if you're listening, then what comes after that is really acting. For us organizationally, I saw something pop up on the chat. It was just around emotional support. You know, we do a lot. We're able to do that for each other. Like a lot of times it's just a matter of having conversations and, you know, trying to be there for each other. But I think, you know, again, because Sue covered a lot of things so well, those are immediate steps, right? Like just really providing ways for when the young person comes home. Like we've been working with parents to develop aftercare plans. You know, like systems are supposed to do that, but it's been hard. It's even harder now because we're doing the physical distancing. And I know I was talking to one mom and she was like, you know, we're hoping that her son comes home soon. And she would, you know, and so not only with the physical, because now the young people are returning home to a very different world, right? And so, you know, they can't really go out and work immediately. And so it was interesting trying to talk about like, even what the emotional support looks like, you know, because a lot of that is physical and welcoming the young person home, connecting them to mentors and different things like that. So a lot of that has to now be done, you know, during Zoom. And a lot of parents don't have access, and young people don't have access to those kinds of, you know, there's a huge digital divide. And so we are working and looking at that and trying to support families where we can, if that means adding funds to their cell phone, looking at digital packaging, how can we get computers or iPads, how can we create activities for young people to do so that they feel supported. And that's really hard. That's hard for children who haven't been in locked up. And so it's equally hard. So again, since Sue covered a lot of those things so effectively, the things that I could add is long-term, right? Like even looking more forward. And so this is more of a call. And I know you asked the question around like the justice agencies, but right now we need to be talking about self-determination and what can we do ourselves. And so like we can no longer wait for systems to develop and approve programming, right? We need to work with, and we have been working to create various types of training and programs and hiring, because we need to hire folks when they come home. We need to hire more family members, right? And so from our organizational perspective, like that's what we've been spending time doing it. And when funders are asking us, what do you need? We need money, because from the last 20 years, so today is no different. What we've heard from our families is that most of our families live in poverty, so we need to remove fines and fees. You know, families are trying to connect with their young people, and they're still having to pay for phone calls. You get 2 free phone calls a week, but come on, I'm a mom. I want to talk to my child all the time, you know, as much as possible. So 2 times a week is nice, but it's not what I need when I know that my child is sitting in a cesspool of, you know, and could possibly contract this virus right away. So we need access to those things. One thing the system could do is free phone calls, you know, and video conferencing, so I can see my child, because I need to make sure, you know, you may be saying one thing, but I need to look at you. So those are some things that are immediately. But again, we're looking at what can we do to train up our young people when they return home, hire them so that they can utilize their experiences and actually make change from that way. So those are some of the short-term free phone calls, video conferencing, and then long-term is a call again for families, for us to come together and recognize that this system is not for us, it's against us. And how can we develop skills and train our own people, our families, our young people to continue to fight the system. And so we're looking for not only funders who are asking to help, but mutual aid and just different ways that we can raise money, that we are able to continue to train our families and young people so that they can move themselves out of poverty. Thank you.
Having some tech troubles. So Gina just teed it up for you, Tracey, because one of the last categories of things, and then we're going to turn to some audience questions that have been populating the Q&A. So if you have a question that you'd like to get into the queue, we're hoping to spend some time in a few minutes answering some of those questions. So Tracey, we wanted to kind of turn to those young people who may remain in facilities. You touched on this a little bit in your earlier remarks. Gina just talked about the importance of video and free phone calls. I'm wondering what other things you might add that are really critical at this time to help families remain in contact with their young people, the information that they need from systems, and how do they preserve that role as a key decision maker about their loved ones?
Yes, so perfect segue. Thank you both Sue and Gina for always sharing the brain. Families need a sense of partnership in the health and well-being of their loved ones when they're behind the walls, and we often don't feel that. Waiving of fees is going to be key, not just for the phone calls and for the teleconferencing, but waiving fees for soap and other personal hygiene essentials that people need. Waive any fees associated with any wellness checks if they exist within facilities. release of low-level offenders, and continually aggressively seeking to release those with a proper plan in place. And we need to, I would say, for system folks, evaluate what our discharge planning is, what we call it in health, what the discharge pre-release planning actually looks like, because we need to make sure that we're not setting people up to fail. This will provide us much more success for our people as they come out. Don't shun the advocacy and activism efforts that families are embarking on at this time. We've been doing the work for a very, very long time. And though we've made great success, the reality is there's still so much more for us to do. Gina has alluded to the fact that yes, we may be at the table, but we don't want to be viewed as just tokens. We want to be viewed as the ones who have the answers for what is going on with our community and with the people that we love. So yes, free video calls, free teleconferencing, making sure that aggressive plans are in place for not just release, but while they are inside, making sure that there is a defined operational and intentional response for making sure that there's no existential spread of the disease or the virus throughout the facility. The virus should be delayed as much as possible from entering the correctional facility. That's one. If it's already in circulation, efforts to control it have to be intense. They should be geared toward preventing the spread, and yet there should also be a plan in place for dealing with a high presence once it is noted. Ultimately, the better the mitigation efforts for public health, legal, correctional, and community and family partnership, the lighter the burden on facilities and communities. Past evidence dictates that the most basic non-pharmacological methods, such as hand washing, have the greatest impact, but they have to be implemented early, they have to be implemented properly, and they have to be implemented consistently. And that's not just for the detainees, but also for the staff as well. And I would just wrap it up by saying, in addition to these recommendations, there needs to be a call for outside observation for making sure that infection control practices and carceral health are being effectively carried out and with fidelity. Without that, we run the risk of losing so much more than our young people. We run the risk of losing the future of our communities.
Great, thank you for that, Tracey. And I do want to get to the questions that are coming in. We did get one question that is focused on young people and families involved in the child welfare system in particular. And Sue, I want to turn to you. I know that this is an area of expertise for you. Let's talk a little bit about young people and families who are duly involved in child welfare and in the justice system. There's been narrative, perhaps in the media, taking a look at what the impact of this physical distancing might mean in terms of abuse and neglect. We know that it's absolutely essential that we view and treat families in a strength-based manner, in a positive light. What guidance would you give to system staff and partners and advocates and others around how we should be supporting families and young people who are duly involved in child welfare and juvenile justice, recognizing that we need to be viewing families in a strength-based way, recognizing their incredible talents and skills and what they have to offer, and that they're the experts on their children and in their families. How do we get there? What guidance or advice would you give with respect to that?
Yeah, it's really important all the time, and these tips are kind of for all the time, but they're especially even more for right now in this period where we are in this just overwhelming crisis mode. And so the three things I would really emphasize: one is communication, that the systems themselves need to communicate better with one another. Families are often caught in the crossfire of getting different information and different regulations and different requirements from the different systems the same child is associated with. So you're told, one thing from your probation officer or your justice system person, and then a different thing from child welfare worker, you have a therapist or a mental health worker, you have an educator, and you're getting different advice, or not just advice, but mandates and requirements. So there has to be this much better communication that the family is there, the table, the family is there for all the communication, and that the messaging and the expectations from the multiple systems are consolidated, so the family is working together as a partner with the systems on a plan that is going to enhance their strengths and support the areas that they need additional support. And so I can't just emphasize that piece enough, because families just feel pulled in just so many different directions when they have these multiple systems, and they often feel like I can't do anything right. If I respond to this system requirement, I'm going the opposite of that one. And whether that relates to work requirements, visitation requirements, all of that, and even more so now, like I said, in the time of the virus, we need to then, the second thing is those more frequent connections, especially for families that haven't been able to be with their child, and even if the child is out in the community, even if the child is on probation or something, but they're in as their justice system involvement, but they're not in the family home because they're in child welfare, so they're in a group home or a foster home. We have to increase their opportunities for connection. One of the things we know about family resilience, and that's the third thing I wanted to mention, and then I'll stop, but one of the things we know about family resilience is that families who are able to communicate that we still have a connection and we have a unique sense of membership in our family unit, we have a unique sense of belonging, we belong to each other as a family. Families who have that and are able to convey that during times of crisis are more resilient. And so we can't let the systems get in the way of families being able to communicate that. Families and their young people need to be able to say, we still belong together even though we're not physically together. We still have a family identity. We still have a family name. We still have a family bond. And the system needs to facilitate that through more frequent communication and so forth, rather than putting additional barriers for that. And so as we look at family resilience and as we look at safety being such a primary, the justice system looks mostly a lot at community safety, and the child welfare system looks at safety, like you said, in terms of child abuse and neglect. But however we're looking at it, we have to remember that safety includes psychological safety and safety from trauma. And so are we so focused on the physical safety that we're forgetting about the psychological safety? And so the systems have to do a better job of coordinating and communicating and understanding how to look at family resilience, which is not the same as individual resilience. But family resilience is like when a family can do problem solving to get through a difficult time. So sometimes a system might see something like, oh, they're having the 12-year-old feed dinner to the 7-year-old. That's a problem. That's a safety concern. Well, actually, especially in times of crisis like this, that's a strength. That's a strength. That's a problem. So we're figuring out how to keep our family safe. We're figuring out how to keep our family going, even with this crisis going on. That's a sign of family resilience. So we have to be able to look at things with a different lens and say, am I just automatically labeling something as a problem rather than asking myself, how could I see that very same thing as a strength? And then identify it, help the family see it, help the family notice and say, I see you. I see you. I see the hard work you're doing. I see the strengths you have. I want to come alongside you and help support you in even enhancing those further. So really learning more about family resilience and what that looks like in the face of crisis, and then identifying it when we see it. And when we don't see it, instead of vilifying the family or saying, see, you're not providing for the protection and safety of your child, say, okay, this is an area, let's figure out a plan that we can work collaboratively together to improve this area that needs improvement. And so building family resilience in that way, through communication and through more frequent connection for the families and their family members.
Thanks so much, Sue. So we have covered a lot and at the same time have just scratched the surface. The Q&A is packed with so many good questions that touch on a lot of things. I'm going to choose just one theme that I'm seeing, and maybe we'll find a way to bring together some answers in another format or something. I'm not quite sure what to do because there's so much rich discussion we could have. But some of the questions kind of all touch on this theme of with young people can make choices that are different than those that adults might make. If young people are coming home at a time when their families are welcoming them, but maybe they might not be likely to respect some of the physical distancing guidance or stay in when we're supposed to stay in. Do you have advice for systems supporting families or for families directly about how to kind of work with that young person around the crisis we're in now? I'm not going to call on anyone. I'm going to let you all volunteer. Have we stumped you?
Well, I'll just say a little bit to piggyback on what I just was saying is that one thing is to help all our people that work within our systems and our families really understand youth development, just what's normal youth development. And it is normal for young people, and it is normal for young people to feel invincible, and this isn't going to really affect me. So to really help have those kinds of conversations in the context of understanding development and working through sort of that negotiated kind of conversation with a young person, that kind of what's in it for them, or how is it to their benefit? How can they still do things they want to do? How can they still have contact with their peers? You know, things like this, even in this kind of environment, and then get their advice. Ask young people, how do you recommend we do this? Young people can be leaders, and again, it's part of their natural best development. So say, how do you think what's your role in helping keep your family safe? What do you think you can do? How do you think you can be part of the solution? And really listening. So I think both understanding youth development
Can you still hear me? Did we lose?
I think we may have lost Sue.
Okay, all right.
Oh, no, I'm sorry. I stopped. I paused.
Oh, okay. And you froze at just the right time because we only have a few minutes. We only have a few minutes more. So I think to begin to close us out, we're gonna talk a little bit about what one idea would you like the audience to take with them today? And I'm gonna come to you, Tracey, and as quickly as possible, please, because we have a couple more housekeeping ideas at the end.
The one thing I want everyone to know is that the importance of making sure that young people have as much access to as many people who are willing to support them as possible, that families self-identify. And that's not something we've lifted up right here, but it is something we all believe in. And I think that as we work on recovery systems and infection control and making sure people are safe and that people have voices at the tables, that they understand that that bridge of support is much more than the biological tethers that our young people have.
Thank you so much. And now maybe Gina?
Yeah, I just need to add a little tidbit, and especially around with some of the things that Sue was saying. I just need to also make sure that we're having a race conversation, so that while we're returning home, because all children are not created, they're not treated equally. And so we just definitely need to have our systems to be having those conversations, because we just had a really bad incident that happened here in Louisiana. And so, yeah, we need to make sure we're talking about equity and all of those buzzwords that we really like to use, because our children are not safe when they return home. So I just wanted to put that in the mix, that we are making sure we're having those kinds of conversations and talking to the police and other community members around that we should value all young people.
Thank you. And Sue?
Yes, thank you for adding that, Gina. Being aware of how short the time is, it's hard to say everything, so that is such an important part. We need to put race into it. We need to put immigration status into it. We need to put gender identity and sexual orientation into it. These are all added factors that mean that not everyone is experiencing this coronavirus crisis in the same way, and that we have to really highlight that every single time we have one of these conversations. And just my closing thought would be the same as my beginning thought. It really is about relationships. So, you know, the more we can help the families, the young people, and the system people that are doing, I saw one of the comments, someone saying, yes, some people in some systems are working really hard and trying creative things and trying to do their best. We need to keep the conversation going, and communication, and keep relationships going. More so now, not less. Social distancing should not mean relationship distancing.
Thank you so much. So in the final minute we have, we want to share a little bit of information that folks can take advantage of on the Vera website and on the Georgetown CJJR website. So this will also be in the recording with the website URLs. Most importantly, I want to thank our panelists for joining us. As I said earlier, we really have just scratched the surface, and we had such an overwhelming response to this webinar. We had so many questions in the chat that we weren't really able to touch. I think maybe we'll try to find a way that there's another vehicle that we may be able to get some additional resources out to folks, because this is obviously a topic that people really want to be discussing. I think just in closing, I would say that these have been, we can't almost use the word unprecedented enough in the times, but as Gina, I think, lifted up, we're being asked to look at what's essential. Some of these things are not different than what were always essential for us in our lives and in our work. We're just being asked to look at them differently, and they're bringing lifted to the surface some of those challenges are the same as they always have been. And so the question for all of us is really, what lessons can we take from all of this to drive our work forward and to create a better future in all of our lives? So with that, I will thank our panelists one last time and thank all of you for tuning in, and close us out.